Hi, I'm Yasmin Razak from Dubai, presenting the Syn Session 4 presentation for IA9200 module Research Topics in Information Security. So, the topic was to come up with a risk management plan for a hospital, identifying the risks, coming up with the controls and recommendations. Risk management is a process of identifying, assessing, and controlling the potential problems before they can adversely impact an organization. It is particularly important to identify risks for a hospital with interconnected complex processes, and it's important for patient safety, for maintaining mandatory health regulations, to prevent potential medical errors, legislations, and security attacks on information systems. So, the objectives of the risk management plan is to prevent compromising of patient safety, which is most important, increased liability risks, and to prevent resulting financial losses due to any of these. The framework that we used here for risk management plan for the hospital is based on ISO 31000, and the risk controls implemented for the hospital meet the policy and the control requirements set forth by NIST. So the top 10 assets were identified for the hospital, and they are the people, the records, medical devices, hospital facilities, data center facilities, application and software, infrastructure, pharmacies, catering, and third party services and agreements. Once these assets were identified, then the threats against these assets were also identified, and I've mentioned against those. Once the threats are identified, then we need to carry out a risk analysis. Risk analysis is done by rating the risk for its likelihood and impact. I've used a scale of 1 to 5 for likelihood and 1 to 5 for impact. So we can see here that the product of the likelihood and impact gives the risk rating. Anything over 15 is considered as a significant risk, and a risk rating of over 25 is considered as high. So on a scale from 1 to 5, I have rated all the risks, and the risk rating, it's none of these risk rating are actually significant or high. However, they need to be addressed. So for people, I think the biggest risk that I identified here is the risk associated with attracting and retaining experienced physicians for hospital operations. Patient records, regulatory fines for non-compliance of patient data as per HIPAA and GDPR. That's the main risk. Medical devices and equipments could be impacted by malware. Hospital facilities, there is a risk that the number of beds and other patient facilities could reduce the patient confidence. Data center facilities, there's a high risk of physical access controls leading to tailgating. Applications and software like the billing system and the insurance systems could be hacked, resulting in loss of availability. Infrastructure involves hardware and like printers, PCs, servers, and there's a risk of unavailability of systems due to natural disasters. Pharmacies are other important asset of hospitals. Any risk associated with pharmacy operations and delivery of products will impact the inpatients as well as outpatients. The catering risk is the risk of food and hygiene services not being able to meet the demand and quality. Third party services like Google Cloud Services, AWS, etc., have the risks associated with sourcing and vendor management. Now, once we identify the rating, then we need to come up with the risk controls. So, doctors, nurses, ward boys, administrative staff, these are the most important asset of a hospital, and unavailability of them can cause a huge risk to the patients. The controls that I've recommended for this is to ensure that there are appropriate staffing levels, the workload assignments are well balanced so that it reduces stress and burnouts, and it will improve the morale and quality of work life. Work hour restrictions, evidence-based shift length, rotation, job rotation, rest periods, and other family benefits will reduce turnover, and this will create huge benefit for the hospital from decreased absenteeism, work-related illnesses, improved patient satisfaction, and increased market share. Patient health records and history have contain very sensitive information, and they have to be protected as per HIPAA, GDPR, and other regulatory acts. And non-compliance of this can result in huge fines. For this, the controls recommended are to ensure that strong authentication methods are implemented. Two-factor authentication involving strong password and a PIN or biometric authentication involving fingerprints, iris pattern or facial recognition, and it should also be accompanied by access controls based on least privileges and roles-based access. HIPAA and GDPR also require that they have clear audit trails, and sensitive data should be encrypted. There should be backup and disaster recovery procedures. If any of these are missing, then the hospital may have to pay huge fines for not meeting the compliance. Medical devices and equipment like X-ray machines, scanners, testing lab equipments, etc., have the threat of malware affecting them. Hence, the control that should be put in place is that they always need to have the secure version of software, ensuring that the default IDs and passwords are always reset. Hospital facilities like air conditioning, wheelchairs, beds, etc., are other important assets, and they have to be available all the time. Inadequate number of beds and other patient facilities will reduce patient confidence. Hence, we can also see that if the beds are inadequate, patients will have to be turned away. On the other hand, over provisioning of beds will lead to wasted resources. Hence, we need to have a resource management system using advanced analytical methods and machine learning techniques to improve patient care, and this will save money. Data center facilities, regarding the risk of tailgating, we need to implement a high volume optical turnstile controlled single door entry with door alarm, and limiting entryways help in combating this risk. Applications and software can be hacked, resulting in loss of availability. So this could result in hospital services being down due to failure of IT hardware or software components, or due to vulnerabilities in IT system management or any other event. Hence, we need to ensure that the systems are all patched and up to date to minimize the vulnerabilities. Ensure that the IT system backup and recovery procedures for critical software and data is available, and backups are stored in a secure and sufficiently remote location so that in case of an incident or disaster, the data can be restored easily. Infrastructure can also have a risk of loss of unavailability due to natural disasters. Hence, we need to ensure that remote monitoring is configured for all these devices. Remote access to devices are tested, and disaster recovery and business continuity plans are regularly tested and improved. Pharmacies, they have a risk with operations and delivery of products to inpatients and outpatients. The controls here are to ensure that stock management of medicines and other pharmacy products are efficiently carried out. Besides that, the timing of pharmacy also needs to be adapted so that they open up early, work over lunch, and close late in order to meet the demands, especially during crisis periods like COVID-19. So, here we can see that not all risk controls have heavy costs associated with them. Some may be just a change in procedures or processes, and may not have huge costs involved in them. For catering, there is a risk of food and hygiene services not being able to meet demand and quality. Food safety in hospitals is given utmost importance because certain patients are at a higher risk of developing foodborne illnesses. Elderly patients or those with chronic diseases or those who take medication um, due to which the immune system can be compromised will find it difficult to fight an infection if they consume contaminated food. Also, the staff managing food and hygiene services should be trained adequately for maintaining standards and ensuring that they have a basic knowledge of how foodborne illnesses can occur. Sorry. Third party services have a risks associated with sourcing and vendor management that we can find with any third party service. We have seen several cases where a security hole in third party service causes breach in an organization. Hence, while signing an agreement with these services, we need to ensure that their security services are diligently vetted. We need to ensure that we have a robust vendor and contracts management process. We have seen the cost of a healthcare breach is $5.6 billion a year, and hackers make a better profit from healthcare data than credit card information. Hence, we need to ensure that we take an integrated and coordinated approach involving all departments to create the risk management plan. It also requires top management support and commitment. Having a robust risk management plan with the controls will ensure that it helps in protecting the hospital assets, achieve long-term growth. It helps in taking risk-adjusted business decisions, ensures compliance with legal and regulatory requirements, helps in maintaining patients' health and safety. And above all, these needs to be implemented and monitored continuously for compliance. I have not given the costs of these controls because it depends on the solutions and the products that are chosen for implementation. However, we can see that the cost of controls is very much less than the cost of the asset itself, and hence it is cost justifiable. These are the references. Thank you for your time. Thanks.